Hey everyone, welcome to another video. So today we'll be looking at a condition that affects the eyes rather than affects the skin. So we'll be looking at conjunctivitis. Basically, conjunctivitis is also commonly called pink eye, because when somebody has conjunctivitis, their eye is kind of like reddish. So it is the inflammation or the infection of the conjunctiva, and this conjunctiva is like the clear thin membrane that covers the white part of the eyeball and lines the inside of the eyelids. So when this conjunctiva is inflamed, the blood vessels in the conjunctiva, they become more visible, giving the eye a red or a pink appearance, like I stated before. So this conjunctivitis, it can affect one eye or both eyes, and it is highly contagious, and it is highly contagious in infectious forms. So it is usually not serious, but it can be uncomfortable, and it may sometimes need medical treatment depending on the cause of the conjunctivitis. So looking at the anatomy, the conjunctiva is actually a mucous membrane that, number one, protects the eye by trapping debris and microorganisms. Then number two, lubricates the eye and mucus and tears. So it lubricates the eye with mucus and tears, and it also has blood vessels, immune cells, and nerve endings. So when the conjunctiva is irritated or infected, it releases inflammatory mediators that cause this redness, swelling, tearing, and sometimes discharge. So for the pathophysiology of this condition, conjunctivitis, it may be caused by infections like bacterial infections or viral infections, and it can also be caused by allergies or certain irritants like smoke, dust. Because me personally, if dust enters my eye, I start to have like this, it starts to affect me badly, and my eye gets all watery and red. So all these kind of irritants can also lead to conjunctivitis. So the body's immune system, it creates a response to these triggers, and this will lead to, number one, dilatation of blood vessels, which will cause redness of the eye, then increase in fluid production, which will cause tearing, and then white blood cell activity will increase, which will lead to swelling and the production of discharge from the eye. So depending on the cause, the discharge may be watery, it may be thick and sticky, or it may be mucus-like. So looking at the causes and the types of conjunctivitis, so we have viral conjunctivitis, which is the most common cause, often associated with colds, caused by viruses like adenovirus, and this conjunctivitis is highly contagious. It usually starts in one eye and it spreads to the other, and there's usually watery discharge, gritty feeling in the eye. So all these things are what is seen in viral conjunctivitis. Then when it comes to another form known as bacterial conjunctivitis, so bacterial conjunctivitis is caused by a particular bacteria known as Staphylococcus aureus. It can also be caused by Streptococcus pneumoniae or Haemophilus influenza. So all these three bacteria can cause bacterial conjunctivitis, and it's also highly contagious. It comes with thick yellow or greenish discharge, and this discharge can glue someone's eyelids shut, and it's usually more common in children. Then we have allergic conjunctivitis. So allergic conjunctivitis, like the name implies, is triggered by allergens like pollen, dust mites, or animal dander, and it's usually not contagious, and it often affects both eyes at once, and it's often itchy. What, like, the person will have watery eyes, and is often accompanied with sneezing or runny nose too. So for the last one, we have irritant conjunctivitis, and it's basically caused by chemical exposure, like exposure to smoke, chlorine, fumes, and it usually resolves quickly once the irritant is removed. And this irritant conjunctivitis can cause redness, burning, and tearing. So for the symptoms of this conjunctivitis, like I stated earlier, red or pink eyes, teary or watery discharge, sticky or crusty lashes, especially in the morning, then itchy or burning sensation, feeling of like you're feeling like something is in your eye, like there's a foreign body sensation, then also having swollen eyelids, and having light sensitivity like photophobia in the more severe cases. So for the diagnosis is usually clinical, based on symptoms and eye examination. So the type can often be distinguished by the nature of the discharge, whether it's watery or sticky. So like I said, if it's watery discharge, it's more of like viral conjunctivitis. Then if it's sticky discharge, it gives more symptoms of bacterial conjunctivitis. Then also presence of itchy or systemic symptoms, and it also depends whether both eyes are involved. So both eyes are usually involved in allergic conjunctivitis, and it also depends on the onset and the exposure history, whether it started from a recent cold. That can give you an idea that it might be viral conjunctivitis, or maybe it started from like an allergy exposure, allergic conjunctivitis. So all the patient's history can give you an idea of what kind of conjunctivitis the patient might be experiencing. So sometimes swabs may be taken for bacterial culture in like severe, recurrent or unusual cases. So other conditions that can actually mimic the same symptoms as like we see in conjunctivitis, for example, dry eye syndrome. Dry eye syndrome is usually chronic, with burning, and it comes with a burning and gritty feeling. Then we have blepharitis. So blepharitis is like inflammation of the eyelids, often coexisting with conjunctivitis. Then we also have uveitis, and uveitis is like a deeper eye inflammation, often with pain and with light sensitivity. Then there is also corneal ulcer, which is more serious and is usually painful, and it may follow like if somebody had like a trauma, or if they had a recent contact lens use. So this can be what can cause it. Then glaucoma too, which is also known as acute angle closure. So it comes with severe eye pain, blurred vision, and emergency. So those are basically the other conditions that can mimic the symptoms of conjunctivitis, but they all have like their distinctive features. So for the treatment, for viral conjunctivitis, there is no specific treatment because it resolves on its own in like 1 to 2 weeks. Then some supportive care that can be given, like cold compresses, artificial tears, and also encourage the person to maintain good hygiene. And also the person should avoid close contact with other people to prevent the spread of this condition. Then for bacterial conjunctivitis, it's usually treated with antibiotic eye drops or ointments like chloramphenicol or fusidic acid. Then symptoms usually improve within 1 to 3 days with the treatment with these antibiotic eye drops. And we can also use sterile saline or warm water to clean the crusts that are seen with bacterial conjunctivitis. So when it comes to allergic conjunctivitis, we can use antihistamine eye drops or oral tablets, and can also encourage person to avoid allergens. We can also use cool compresses that can help to reduce the itching. Then sometimes mast stabilizers or mast cell stabilizers or steroid drops may be used in severe cases, but they should also only be used in short term. Then we also have, for irritant conjunctivitis, we have to rinse the eye with clean water or saline, and avoid the substance that is causing the conjunctivitis, the irritant basically. And for this particular kind of conjunctivitis, no medication is usually needed unless a secondary infection occurs. So once the person tries to avoid the irritant that is causing the conjunctivitis, it usually resolves on its own. So in summary, for the management and prevention of conjunctivitis, it's good to keep proper hand hygiene. Hand hygiene is key. Try to wash your hands before and after touching the eyes, and avoid sharing towels, cosmetics or eye drops, and do not use contact lenses during an active infection. So if you have conjunctivitis, it's better to avoid using contact lenses, even if you are someone that is addicted to using contact. Once you have any condition of the eye, it's just good to avoid it during that period, because what you are having can be you might not know, but it might be your eye reacting to that contact lens, and then you using it at the same time. It's like you're not even helping yourself. So when it comes to in cases where somebody has allergic conjunctivitis, it's good to reduce the exposure to the triggers. Like if you know it's dust that triggers this thing, try to avoid it. If you know it's pollen, try to avoid it. If you know it's certain pets, just try to avoid it. And it's good for patients to not use leftover eye medications, because there was a time, because me, I usually use there's this particular eye drop I usually use. It's known as travel prost. So it's used to reduce intraocular pressure. So there was a time I used this eye drop. Like I usually routinely, it's something I use on a daily basis, but I forgot it for like a period. I forgot to use it because I was having exams that period. I did not use it for like almost 2 weeks, and it was already opened. And when I now use it again, like I finally remembered, oh, I have this eye drop, I have to use it after my exam finished. And I used the eye drop. The next day I had red eyes when I woke up. Like I could see the blood vessels of my eyes, like. And after that I just threw away that eye drop. I didn't use it again. And then when I bought a new one, I used it. I did not see that sign again. So it was a sign that leftover eye medication that I used, it had been contaminated basically. So that's why it's not good to use leftover eye medications. So in summary, conjunctivitis is a common eye condition that is caused by infections, allergy or irritants that leads to red, itchy or sticky eyes, and it is usually mild and self-limiting, but can be contagious, especially in viral and bacterial forms. And treatment usually depends on the cause, and it may include antibiotic drops if it's bacterial, antihistamines if it's allergic, or just simple eye hygiene if it's like irritant conjunctivitis, for example. So it's good to know what exactly is causing your conjunctivitis based on your symptoms, and try to maintain eye hygiene, and try to seek medical attention if the conjunctivitis comes with pain, vision loss, or if there's no improvement, because the eye is one of the most important organs of the body, so we should take care of it. So basically, that is the summary of this condition known as conjunctivitis. So I'll see you in the next video. Bye.